Next up is Dan Joutras, a local disability services expert presenting Carbondale Spring Care Worker initiative.
Yes, thank you, Claire. I'd like to begin by having you all indulge me in just a moment and think back to when you were in first grade and your teachers had you put on your imagination caps. So I would like you to physically put on that imagination cap here with me today. And I'm actually asking every single one of you to put on that imagination cap with me today. Some of you just don't have it, I guess. That's a really beautiful cap, though. So let's start off by imagining in your mind's eye what you perceive to be the pressing social issues of our time. What shape do these issues take for you? And can you put a human face to them? You might think of poverty, homelessness, substance abuse, mental health crises, personal violence or abuse in any form, the concept of crime and incarceration, or really any other unnamed trauma that is unique to the individual who experienced it. Perhaps the face of a loved one came to mind. And I think that we can all agree that these problems have deep and entangled roots to which there is really no singular solution. But as a community, we have left these problems to be solved at the hands of, first and foremost, an overinflated social and human service sector, whereby the United States boasts over 1.5 million organizations sharing nonprofit status, with over $3 trillion in the economy. And secondly, at the hands of an overcrowded punitive justice system, whereby 45% of all prison inmates are convicted of drug or alcohol-related offenses, and 37% have a history of mental health concerns. And then finally, at the hands of an over-aggressive police force, whereby nationally officers have about an average of 110 hours of training in self-defense and firearms, yet only 8 in conflict resolution and mediation. So as Claire said, after a lot of research and reading and hours of conversations, both with those who have experienced these issues and those who just seek to change the conditions in which create them, the Carbondale Spring has proposed this initiative of developing a local team of care workers, incorporating innovative methods that have proven effects on transforming the way that these issues are addressed at the local level. So the idea would revolve around a team of highly trained and experienced individuals providing a comprehensive four-pronged approach to these problems. And so that first tenet and responsibility of the care worker would be to provide crisis intervention. And I'm going to talk a little bit about the basis of this initiative being modeled after a program called CAHOOTS in Eugene, Oregon, that Nick had mentioned. And they operate off of a budget of $1.5 million. And last year they recorded about 16,000 calls that they responded to. And those addressed issues such as suicide prevention and intervention, conflict resolution, substance abuse, housing concerns, first aid, non-emergency care, and those are, some of their most popular. They operate a 24-hour hotline where they provide services within the community using a mobile health unit, and that's staffed with 2 individuals, one who has a medical background, either being a nurse or a medic, and the other being a crisis counselor. They partner with their very own Whitebird Clinic, where they divert any medical or psychological care outside of traditional or conventional healthcare services if they are capable of doing so. And that has really decreased the financial burden put on both the individual and their community at large. So I do want to say that CAHOOTS is a service separate from their police force. And that's really important, and to which its independence as a service is really credited to its success. Their police force had actually diverted 17% of their calls to the CAHOOTS program that they took care of last year. So the program has been so successful in decreasing this burden put onto its city that the state of Oregon is using it as a model of best practices in the field, and really encouraging other cities in their state to adopt similar programming. Cities as large as Oakland, California, and New York City have advocates that are trying to implement the same models. And there are others throughout the nation that have different approaches that are unique to their individual communities, such as the Care Zone team in Boston, the Tucson Mental Health Support Team, Behavioral Health Response in St. Louis, and the Common Ground Health Clinic in New Orleans. And these are just a few prominent examples. So therefore, the Carbondale Spring envisions that first element of a care worker would be to provide crisis intervention similar to this model. Imagine establishing partnerships with community-based services such as Jackson County Health Department or Shawnee Health Services, how that aspect can prevent further financial burdens, just like the way the Cahoots model does. And perhaps you can envision the impact of creating a brand new clinic within the Irma Hayes Center, what that would have for the possibilities within the community. So instead of criminalizing these effects of trauma, care workers would really want to interact in a way that respects an individual's identity, their safety, and overall humanity. So despite the relative successes of these programs that I've mentioned, that they really are limited in that they cease at the offering of crisis intervention and referral services. And this is where the Carbondale Spring really stands out in its proposal under this initiative to incorporate other innovative strategies, proactive strategies that kind of change or address the way that we interact with one another. So that second responsibility proposed would be to provide regular check-ins, and that would be for individuals who either request welfare checks or maybe they are identified as at risk, either because they are frequented by the police or have multiple occurrences in the healthcare service, in the healthcare system. Imagine a care worker maybe taking that extra time to really build a relationship and establish rapport with those individuals in our community, and how that would affect their previous experiences with the social service system. How might that personal relation really compare to that traditional or clinical approach? And how does building that relationship outside of the times of crisis that individual experiences, how would that affect when or how they might seek out additional help? So it's proposed that in establishing this atmosphere that's constructive and non-judgmental and absent of criminalization, that a care worker can really create that space for an individual to access the care that they want in a manner that best suits their needs. So then this third proposal would suggest that care workers would help to establish and train what is called a neighborhood network. This would resurrect the original idea of building the block, wherein care workers would really assist in connecting those who live in close proximity to one another and kind of reimagine the ways that we build relationships and interact with our neighbors. Maybe you can envision identifying folks who offer various skills and would be interested in volunteering their time or abilities when a neighbor is in need. Sometimes individuals want to offer help and they just don't know when a neighbor is in a time of need. So maybe under the guidance of this initiative, a community-wide catalog of individuals who possess these skills would be created, and that would allow for space for actual neighbors to respond in another neighbor's time of need, rather than sending out a care worker where this might be allowable. So by facilitating this outreach and volunteerism, it's imagined that it would ensure the general well-being of those living near one another, from basic assistance with jumping a car battery to mediating a dispute between friends. Care workers will absolutely be integral in rebuilding this broken social structure that kind of keeps us currently isolated from one another. And so this fourth and final prong that a care worker would be responsible for would be expanding upon what is known to be transformative justice approaches. So we all know that this current punitive justice system that we have focuses on reactionary and punishing strategies of an individual and their actions. And from that, restorative justice has emerged as a more compassionate approach. But they're both extremely limited in that they don't address, in all of its complexities, why an individual who might create a harm or a crime is likely experiencing some type of trauma or oppressive conditions in their own existence. And so therefore, care workers will help to organize these principles by, first and foremost, ensuring the safety and the healing of the individual who has been harmed. And secondly, to establish accountability of the individual who committed that harm. And then finally, establishing accountability and a comprehensive response from the broader community at large. We all need to be involved in these decisions. So maybe you can imagine care workers moving through all of these various prongs, as previously mentioned. And I think that in coming to know firsthand the traumas that individuals experience in our community, that they would be well equipped to better identify these innovative approaches, to suggest trainings, to suggest new services of how we approach these concerns. And maybe you can envision a partnership with the Center for Empowerment Justice and how that would help to heal this past violence that we've seen and address the current violence that we see, and really ultimately provide space for mobilizing toward a fundamental change in the future. And so you might say now, but Dan, what about all of these services that already exist with the state and local provision? And to that I say that I want you to think about the current grant and government funding structure and how that ultimately perpetuates a little bit of financial corruption. And it really pits the good missions of organizations against one another as they're fighting in a dogfight for cash. And that's just fundamentally wrong in my eyes. By diverting this responsibility and the accountability of us as a community, I really think that we miss out on that opportunity to explore these transformative approaches and really create space for a social change over a social service. And then you might say, but Dan, we still need to have the punishments in place and instill justice where justice is deserved. And even then, I say that we continue down a path of using dehumanizing and reactive strategies that really don't address that condition that created the crime in the first place. And those included in this mass incarceration in our country are offered little to no resources on the inside, little to no resources on the outside, and it really just feeds into this nonprofit nightmare that I've already explained. Why must we continue to accept the criminalization of poverty and substance abuse and mental health? And I'd like to pose a deeper question here. Who are we giving the authority to instill justice or determine that justice anyway? And so then finally you might say, but Dan, we still need to have the police around for certain dangerous situations. And I agree, and this is to expand upon Nick's points, that we have asked the police to be responsible for things that they are really not equipped to handle, for things that they likely did not want to handle, as when they went into their career field of choice, they wanted to be an officer and not a social worker. And then we have this surplus of folks who go into massive amounts of student loan debt to get that education and training, to learn how to heal this illness that we call the human condition, and want to offer their help in that capacity. So I say that we must reframe these issues faced here in Carbondale completely outside of the context of the police, creating community in ways that we want to build and not in which is dictated to us. So I'm going to leave you with this, that the biggest prison is sometimes a conditioned mind. And for that, the Carbondale Spring has really thought creatively to dream up a new concept of care here within our town. This is an opportunity for us to seize upon using our local tax dollars and make true on that promise that Carbondale is a welcoming and compassionate city. We must step outside the discomfort of our current frameworks in order to achieve this viable transformation in our community. I really appreciate you taking the time to imagine a better Carbondale here with us today, and look forward to working with you all and making it a reality in the future. Thank you.